aspiration and biopsy is an invasive diagnostic method. It should be performed by a trained personnel, a hematologist, a hematology trainee, or a medical officer. There is a important role that the MLTs and the nursing officers have to play in this as well. There are two specimens that are obtained. One is the bone marrow aspirate, which is a semi-liquid bone marrow fluid. And the second one is the Trephine biopsy, which is a narrow, solid core of bone. Today, we will see how both these specimens, the aspirate and the Trephine biopsy, are collected. And we will also learn what the MLT's role is and what the nursing officer's role is. There are many indications for bone marrow biopsy, and you will see many patients undergo this procedure for a diagnosis. When we are small, the whole of our marrow produces red cells, white cells, and platelets. But when we are adults, the hemopoiesis is confined to the axial skeleton and the proximal ends of the long bones. Therefore, the sites of bone marrow would be, in an adult, the sternum, anterior superior iliac spine, and the posterior superior iliac spine. In children, because the whole of the skeleton produces red cells, white cells, and platelets, or has hemopoiesis, the tibial tuberosity can also be used. Because the sternum is very close to the heart and the underlying vessels, it is not preferred anymore. The most preferred site is the posterior superior iliac spine. This is a picture of bone marrow needles. There are disposable bone marrow needles and reusable ones. We are moving more towards disposable ones, and therefore in the wards, as medical officers, nurses, and MLTs, you will be seeing more of the disposable ones. As nursing officers, if your ward is using reusable bone marrow needles, it is your responsibility to make sure that all the parts are there after a marrow has been performed, and to make sure it is autoclaved and kept ready for the next bone marrow procedure. We will go through this procedure in the video, therefore I will not go through it here. The nurses need to have all these ready for the procedure. They need to have alcohol and betadine and some surgical spirit for cleaning, sterile swabs, sterile drapes, local anesthesia, and needles and syringes to administer the local anesthesia, number 11 scalpel blade, bone marrow needles, 20 and 50 ml syringes to aspirate the marrow, EDTA bottles and other bottles as necessary, and picric acid solution to place the Trephine in, pressure dressing, and plaster. The MLTs need to have lots of slides to draw bone marrow aspirate slides, spreaders, labeling, pencils, forceps to prepare Trephine touch, extra EDTA bottles and other bottles as necessary, picric acid to place the Trephine. After the procedure, the patient is expected to lie on the bed to exert pressure on the marrow site for about 4 hours. The nursing officer needs to watch for bleeding. She can ask the doctor and give paracetamol if the patient is in pain. The patient is asked not to wet the site for a day. So let us now go to see what the MLT needs to have ready prior to the marrow, what the nurse needs to have ready prior to the marrow, and the marrow procedure itself. We have here the items that a medical laboratory scientist needs to have before a bone marrow biopsy. The essential items would be slides to make bone marrow aspiration slides, a spreader, a petri dish to collect the aspirate into, EDTA bottle to put extra aspirate into, forceps to make the Trephine touch, picric acid bottle to put the Trephine core into, formal saline to put a clot biopsy into, and lead pencils and other labeling. Apart from this, if you need samples for PCR, cultures, flow cytometry, cytogenetics, you need to have those bottles ready as well. So we have here the items that a nursing officer should have ready prior to a bone marrow biopsy. What she needs is gloves for the doctor to use, sterile drapes, cleaning, betadine and surgical spirits, and then for the marrow she needs lignocaine. Make sure that you check the expiry date and that it is not expired. We need a 5 cc syringe and needle to administer the lignocaine with. Then we need a number 11 surgical blade to put the nick. We need the bone marrow aspirate and Trephine biopsy needles, a 20 cc or 50 cc syringe to perform the aspirate with, and we need EDTA bottles. After you do the marrow, you need to put a pressure dressing, so you need elastoplast and scissors for that. You may need many gauze packs to swab off the bleeding as it occurs. Apart from these, you may also need to get bottles for cultures, PCR, cytogenetics and flow cytometry if necessary. Prior to the bone marrow, as the first step, the medical officer needs to explain the procedure to the patient, the possible complications, and obtain consent from the patient. The next step would be to position the patient. We have to put the patient on the left lateral position because we are going to do the bone marrow from the right posterior superior iliac spine. So we have to position the patient, feel for the iliac crest and locate the posterior superior iliac spine. Meanwhile, the medical laboratory scientist can get his slides and the containers ready to put the marrow specimens into and to draw the slides. Once the patient has been positioned, the site has to be cleaned. So the nursing officer needs to give the doctor several sterile swabs and also the cleaning agents, the antiseptic agents, betadine or surgical spirits. Here the doctor is going to clean the site 3 times from inside to out, from where she localized the posterior superior iliac spine, this exact spot, from that spot outside. So they are cleaning 3 times, twice with betadine and once with surgical spirit. So the nursing officer's role is to provide the sterile swabs and the cleaning agents. Once the patient has been positioned on the left lateral side and the right posterior superior iliac spine has been located, the doctor can wear a fresh pair of gloves, sterile gloves. As the site has been already cleaned, we can put a sterile drape with a hole in it so that the right posterior superior iliac spine is now visible through the opening. The nurse has to make sure that she or he opens the sterile drapes and gives the doctor. The nurse has to now give the doctor a 10 cc syringe to administer the local anesthetic. 2% lignocaine without adrenaline is used, and you have to make sure to check the expiry date and hold the lignocaine up for the doctor to take enough local anesthetic into the syringe. Hold the bottle up like that so that the doctor can take enough local anesthetic into the syringe. Open your sterile swabs and give some swabs to the doctor. She will be using these swabs when administering the local anesthetic. After warning the patient, the local anesthetic is given first to the skin, to anesthetize the skin, and then to the subcutaneous tissue and right down to the periosteum. When you feel the periosteum, give some to a area so that the periosteum, which is also a sensitive tissue, is anesthetized well. Before you give the anesthetic, withdraw the syringe a little bit to check whether you are in an artery or vein. While the local anesthetic is working, you can get your bone marrow needles ready. And your number 11 scalpel blade ready. The nursing officer has to open the scalpel blade like that without touching the inside and give the doctor the number 11 scalpel blade. That is the next step that they have to do. And then you have to check if it is a disposable bone marrow needle, check for the expiry date and open out the bone marrow needle in a manner that is shown and give it to the doctor. If it is a autoclaved reusable set, then make sure you open it and give it to the doctor. Open it in a sterile manner so that you do not touch the contents inside the packaging. Here you can see the bone marrow needle with the trocar and the stillet to take the Trephine biopsy out. And now the doctor is using the number 11 scalpel blade to make a small nick in the skin of the patient. Once a small nick is made, the bone marrow needle is checked whether it fits properly. The trocar has to fit nicely into the bone marrow needle and it has to lock properly. The nursing officer has to make sure that there are plenty of sterile gauze for the doctor to use. Once the nick is made and you are ready to go in, the nursing officer has to make sure that there is a 10 cc or a 20 cc syringe. Sometimes you might even need a 50 cc syringe to aspirate your bone marrow. So the next step is to have those ready while the doctor is going to start the bone marrow. The aspirate needle is inserted into the small nick that was made, the nick in the skin, and you have to go perpendicular to the bone. As the periosteum is slippery, you might have to steady the patient with your other hand. Make small movements, making small movements to the left and to the right, small semicircular movements. You can drill into the cortex of the bone, always going perpendicular to the bone. When you have entered the marrow cavity, you will feel a resistance. Insert your 10 cc or 20 cc syringe and get the aspirate. The MLT has to be ready, and the aspirate will be put into a glass slide or a petri dish. Holding the dish or the glass slide at an angle, let the aspirate flow down and take the fragments from the top and make quick slides as you would make blood smear slides. You must do this before the aspirate clots. The rest of the aspirate can be taken into an EDTA bottle. The nursing officer can take this, or the MLT can take this. Make sure you tilt it quickly to prevent clotting. The EDTA sample can be made use to make slides later. Other samples for PCR, TB PCR, cultures, flow cytometry, cytogenetics have to be taken now before you go in for the Trephine. Since we didn't take for that, we are now going for the Trephine. Using the same site in the skin, you enter, but using a different site in the bone, you go in a little bit, take the trocar out and advance a further 2 centimeters or more. Make sure you dislodge the bone with movements anti-clockwise and clockwise and take the Trephine out. The bone marrow stillet is used to take the Trephine out. The MLT has to be ready with a slide to take the Trephine biopsy onto it. He is now making a Trephine roll. You can roll the Trephine like that, and that's called a Trephine roll. And now he's making a Trephine touch. You can touch the Trephine on with another slide like that, and that's called a Trephine touch. You don't need to make a Trephine roll and a Trephine touch both, but one of them, at least a Trephine touch, is necessary in case you get a dry tap. Now slowly place your Trephine biopsy in picric acid. Make sure it is fully immersed in the picric acid, and the nursing officer must label the EDTA tube and the picric acid tube carefully. Make sure you have achieved hemostasis properly, clean the area, and use a thick warding of swabs because you need a high pressure dressing at that area. Over this, you have to put the elastoplast. So the nursing officer has to have the cleaning material, the swabs, and the elastoplast ready. Put the plaster firmly like that, and then you have to turn the patient onto his back so that he will put pressure onto this. After the procedure, the patient is advised to lie on his back for a period of about 4 hours. This will apply pressure on the site and prevent bleeding. The nursing officer needs to check on the patient periodically and especially look for any bleeding. If there is any pain, paracetamol can be administered. The patient is advised not to remove the plaster for a period of 24 hours and not to wet the site for 24 hours.